Hey, how you doing? Let's have a conversation about how the flow of information impacts an organization's operation. Please join me on this journey of knowledge dissemination. Enjoy the video. I believe that healthcare is an important topic to many people, irrespective of their background. I am not a medical professional, lawyer, or politician, but I am someone who is deeply passionate about understanding the complexities of transferring critical know-how within this field. The whole idea of knowledge management is to ensure that the right information is provided to the right people at the right time. The healthcare industry has always been knowledge-driven. But what does that look like? What should it look like in the 21st century? I'll begin with something everyone understands: money. Over the last 50 years, healthcare expenditures as a percentage of U.S. gross domestic product has tripled. Between 2011 and 2019, healthcare expenditures are expected to be near 18% of U.S. GDP. In that same time frame, healthcare expenditures are expected to comprise 12% of employer health spending. Interestingly, national and private health spending has declined over the last 50 years. This reduction could be the result of implementing more efficient processes, it could be the result of budget cuts, or it could be the combination of these two plus other factors. But a more striking trend is the projected growth in disposable income. It's expected to flatline from 2021 to 2025, decline further in 2026, and then by 2028, it will return to where it was in 2021. So, although healthcare costs continue to rise, and national and private spending declines, people's ability to pay for healthcare may weaken over time due to less disposable income. Starting in 2020, the disposable income for Americans might not increase for nearly a decade. Why is this? What could possibly be driving healthcare costs to these heights? Here are just a few factors: technology and innovation, drug spending, government regulation, demographics, lifestyle choices, inflation, and organizational process management. All of those elements are important, and they illustrate just how multifaceted healthcare is. Though each one deserves its own analysis, I'm going to focus on the process and information management aspect of healthcare. To be clear, I am not suggesting telling physicians, clinicians, nurses, and other healthcare providers what to do. No need to micromanage them since they are the subject matter experts. Instead, I'm advocating for an environment that empowers physicians, clinicians, and nurses to do what they do best by increasing the accessibility and availability of relevant information needed for decision making. In other words, KM in healthcare should not be about managing these workers per se, it should be about engaging them. In my previous videos, I mentioned missed opportunities when frontline workers are left out of the conversation. Additionally, I've noted the importance of creating an atmosphere where employees feel like they can succeed. Healthcare is the same, with one small difference. People could actually die if the flow of valuable, time-sensitive information is stifled. This runs the gamut from knowledge hoarding to poor human capital management. The Ethiopian Journal of Health Science has done some interesting research on how KM is implemented in healthcare. The journal has identified KM benefits at 4 levels: at the individual level, customer level, organizational level, and sector level. Individual benefits to KM include improved learning, better decision-making, more effective problem-solving, and increased productivity and job satisfaction. Customer benefits to KM include faster services and reduced error or quality problems. Organizational benefits to KM include improved staff collaboration, faster information flow, thus saving precious time, reduced duplicated work, improved information accessibility and availability, better information quality, and creation of new knowledge. Sector benefits to KM include improvements of standardization. As great as those sound, there are challenges. The Ethiopian Journal of Health Science identified some barriers worth noting. Infrastructure and technological constraints, lack of motivation for employees to share knowledge, system unreliability, lack of senior management support, organizational politics, patient privacy issues, reluctance of clinicians to use ICT, information and communication technology, tools, poor attention to results and use of evidence, lack of incentives for documentation and dissemination of knowledge, limited document and use of good practices, inadequate awareness of KM systems, expensive initial investment, poor quality of patient data or information, inequity of status among practitioners, organizational culture, no centralized system, lack of trust. There is hope, though. Consider these 4 innovative approaches to health services. 1. Evidence-based decision-making to improve quality of patient care. Accountability from care providers for the outcome of patient treatment is the core rationale for this practice. Therefore, a process of continuous learning is essential in the 21st century healthcare environment. The quality of healthcare delivery will increasingly be influenced by emerging technological capabilities such as the automatic semantic processing of text to deeply explore complex information needs. Minimizing the gap between research and practice helps ensure that the patient is at the center of healthcare. 2. Virtual communication and knowledge flow. Home health rehabilitation via virtual networks allows patients to receive services even when physical travel is not possible or convenient. Smart home technologies that provide real-time access to a network of telemedicine and other support could be one solution to expand access to health services in a cost-effective manner. 3. Clinical decision support system. Information retrieval tools can help clinicians locate relevant and specific knowledge, especially when integrated with an electronic health record system. Then, when combined with a knowledge management system, clinicians can receive guidance on a range of strategies and resources during the decision-making process. Together, these systems can improve quality and safety at the point of healthcare delivery. 4. Electronic health record systems. I spoke about electronic health record systems just a few moments ago. An added benefit to this type of system is that public health authorities will have reliable, real-time data to support health policy decisions. Effectively, this type of system provides a collaborative, virtual environment for resource utilization and knowledge access. Whew. Suffice it to say that healthcare is a complicated topic. I'll end by focusing on Hippocrates of Kos, an ancient Greek physician. Hippocrates is widely considered to be the father of Western medicine, so much so that an oath has been named after him that many medical schools take today. A modern version of that oath was written in 1964 by Louis Lasagna, who served as academic dean for over 2 decades for the School of Medicine at Tufts University. Here is that oath. I swear to fulfill, to the best of my ability and judgment, this covenant. I will respect the hard-won scientific gains of those physicians in whose steps I walk, and gladly share such knowledge as is mine with those who are to follow. I will apply, for the benefit of the sick, all measures that are required, avoiding those twin traps of overtreatment and therapeutic nihilism. I will remember that there is art to medicine, as well as science, and that warmth, sympathy, and understanding may outweigh the surgeon's knife or the chemist's drug. I will not be ashamed to say, I know not, nor will I fail to call in my colleagues when the skills of another are needed for a patient's recovery. I will respect the privacy of my patients, for their problems are not disclosed to me that the world may know. Most especially must I tread with care in matters of life and death. If it is given me to save a life, all thanks, but it may also be within my power to take a life. This awesome responsibility must be faced with great humbleness and awareness of my own frailty. Above all, I must not play God. I will remember that I do not treat a fever chart, a cancerous growth, but a sick human being whose illness may affect the person's family and economic stability. My responsibility includes these related problems if I am to care adequately for the sick. I will prevent disease whenever I can, for prevention is preferable to cure. I will remember that I remain a member of society with special obligations to all my fellow human beings, those sound of mind and body as well as the infirm. If I do not violate this oath, may I enjoy life and art, respected while I live and remembered with affection thereafter. May I always act so as to preserve the finest traditions of my calling, and may I long experience the joy of healing those who seek my help. This ancient oath can serve as a guide to KM efforts, creating an environment where people, process, and technology work with great synergy depends upon many variables. As the healthcare industry continues to shift to a model more appropriate to 21st century challenges, it is indeed important to remember the core purpose of healthcare in the first place. Thank you for watching. I encourage you to provide feedback and participate in this conversation. Comment, like, subscribe, visit my website. I'd love to hear other perspectives because knowledge is for everyone.